specificity in musculoskeletal diagnosis. There's this little paper that's been going around that's pretty recent, discussing meta-analysis around how people react, how patients react and perceive things when diagnoses are made very extremely specific for musculoskeletal problems versus a little less specific as far as treatment goes, outcomes, and further procedures and testing and things like that. So to kind of keep it brief, what they've found is, well, first things first is very ultra specific diagnoses for musculoskeletal problems in the world of medicine, physical therapy, chiropractic care, all those things. There's very specific labels for what you think is going on with a patient, whether it's through history, exam, imaging, things like that, that you must code to in order to be paid, right? So the level of specificity of a diagnosis will dictate the how much you're paid by an insurance company if we're playing that game, and then what kind of timeline you can use to treat the person. So the specificity has a value in that way, because then I can get paid for certain things depending on what I'm diagnosing. Okay, so but as far as the patient is concerned, what they find is, yes, maybe a person is more quote satisfied with a visit to their doctor or other musculoskeletal health provider if a specific diagnosis is given to them. But what you find is people tend to have slower rates of recovery, more catastrophizing, worse outcomes, more difficulty, or wanting to have further procedures done that may not be warranted, have imaging done that might not be necessary, when they're given those very specific diagnoses. It just seems like people, they get trapped on the thinking about that. They have bigger feelings of not being able to be fixed. They have bigger feelings of things that are going to be permanent problems. So it's always a difficulty as a clinician about being as specific as you can with the patient about what's going on with them. But the other side of the line you have to ride is to make sure you are not presenting the specificity information about what's wrong with them in such a way that creates undue stress, undue worry, fear, catastrophizing, things like that. So you have to it's always that dance you're trying to play, making sure, hey, this is what's going on. We did the testing, the imaging, and we've seen X, Y, and Z, but I have to frame it in such a way that makes sure that the patient understands what's wrong with them, but also understands that what is happening to them is not a permanent problem, is going to heal over time, and we're going to take the best course of action given the evidence we have around what we can do. So you just have to be very mindful of those things, because sometimes the instant somebody hears that they have a bulging disc in their back, or they have arthritis, those words have become scary to people into the layperson, even though those things don't really, they're just descriptors of what you're seeing, and they just create a diagnosis for the doctor to report to an insurance company. They don't mean anything about what kind of quality of life you can have, how good you can get, how much better your body's going to heal, and things like that. So you always have to make sure you're framing stuff in a way that sets the person up for success, sets them up to follow through with your guidance, sets them up to understand that they can get back to their normal things, and their body is going to trend towards healing, and these diagnosis labels aren't things that they need to carry with them that are going to be permanent obstructions to their quality of life. And one of the more interesting things, which kind of gets rooted deep into human nature, that they found in this meta-analysis was a lot of people, I'll leave you with this thought, a lot of people wanted that ultra specific diagnosis about what was wrong with them so they could explain what's wrong with them to other people in social settings. They want to be able to say, I have a disc herniation. They want to be able to say, I have knee arthritis, and that's why I can't help you move your piano, or whatever it is. They want, in those social situations, they want to be able to have that diagnosis to point at, so that people can validate their feelings. And that becomes this whole other can of worms as far as the psychological nature of injury and how people react to it and how people want to portray what's going on with them to the others around them in their community. So that's enough for today. Check my channel for more. See you later.